Welcome back to our Riverside Chats. For months now, you have seen videos from the Public Health Department, but do you really know what we do? It's actually a lot, and there are a lot of programs run by a lot of people, and you know what? I'm going to let them explain it to you.
My name is Haley Eshelman. I am the Home Visitation Supervisor for our Healthy Families Nebraska Two Rivers program.
And why is that so important to public health?
Public health is all about filling the gaps. So there was recently a survey done that identified 2 of our 7 counties that needed a little extra support in the area of parenting needs, and being able to be connected to resources. So we are actually able to support that gap by providing the Healthy Families program and supporting parents in all of their parenting skills. So we currently have 4 home visitors that speak a variety of languages, which allows us to be able to diversify the families that we work with and are able to connect with. And they go out and provide home visits to families and children that ultimately just need a little extra boost. So maybe it's getting them connected to resources. It might be empowering the positive parenting skills that they are already doing, or it could be teaching them a few new things along the road.
We're really fortunate because we get to work with families and it's a lot of fun. So we get to go out in their home. We can meet them in a public place like for a coffee or at the park, the library. We use our local children's museum also. And what we do is we get together. We first check in with the families to see how things are going. And then we go ahead and we talk a little bit about maybe what the mom or the dad or both need as support in their parenting skills. Next, we go ahead and we talk about the parent, how they are feeling, like where their headspace is. We talk a lot about mental health. We don't provide mental health per se like a physician, because we can't, but we're a supportive partner in those type of things. Do you take time for yourself? We talk about self-care, how important that is. We talk about maybe what it would look like for her to get a break. So we talk about if there's a couple, we talk about how they can go ahead and balance out each other and they can take turns. We talk about the duty sharing. Maybe it's cleaning the house, washing the clothes, taking time with the child, letting each have a break. The other thing we talk about too then when we're there with the families is just in general if the other kids need help. Let's say there might be a car broke down, rent is due. We talk about everything, honestly. So we do like a little back and forth on if you put one blanket around a child, that's great support. But think if we had 2. Think about all the securities we can give our children by giving them a safe, happy environment. And what we're building a strong, resilient family unit. And that's what we really want to encourage and continue by building a good community. Intake then that the families go ahead and turn around being great for our communities too, because it is like a pay it forward.
My name is Jackie Haley. I am the clinical section manager at Two Rivers Public Health Department. So our first program that I want to talk about is our Life Smiles dental program. So Life Smiles program works with local schools and early childhood centers to deliver oral health education, oral screenings, and provides fluoride and sealants to school-age children. So we're giving these kids early tools to keep their oral health good.
Okay. And what's your other program?
Two Rivers Vaccine Program offers vaccinations for both children and adults, and we utilize insurance or private pay, or we have 2 state-funded programs. The first is called Vaccines for Children program, and the second is Vaccines for Adult program, or VFC. And basically, we provide as many routine vaccinations for adults and children as we can. Yeah, we have clinics both in the office and we have mobile clinics. So we are routinely in Lexington, Holdridge, and Cozad every month, and then as always in Kearney. But we do vaccines for children clinics weekly in Kearney.
All right, my name is Jordan Anderson. I am a public health nurse RN here at Two Rivers. Yeah, so I'm going to be talking about disease investigations. So disease investigations as a whole is used to identify the source, cause, and risk factors of a disease. And this can be in individual or in outbreak situations. So each of the nurses does everything. We do all the DI, but each nurse has like a specialty area. So I, for instance, handle STIs and HIV. Liz handles lead and Melissa handles the TB program. So it plays a huge role in public health because it helps identify, understand, and control outbreaks or the spread of diseases within a community. And it's essential for managing the health of communities we serve as a whole. So the Q houses all of the reportable conditions. It's the Nebraska Disease Surveillance System, and sometimes it's as easy as just clearing it, and sometimes, we open a case, but we don't have to call. On some of the bigger diseases, we do have to call, interview patients. Sometimes we call the doctor's office, interview doctors. On big ones like tuberculosis, for example, we have to get them all set up through the state, and then our TB nurse Melissa goes and daily she gets to watch you take your meds for TB. So that's what we do. So if you have any of the reportable conditions, you'll get a call from us, and we'll try to identify your source, try to identify potential close contacts, and if it stays with you, great. And we just want to prevent the spread. So if it does turn into an outbreak, not great, but we'll handle it too. So we just want to keep everybody healthy.
So my name is Ashley Green, and I am the Environmental Health Supervisor here at Two Rivers Public Health Department.
And tell me a little bit about your program.
So we received a $1.3 million grant from the Federal Department of Housing and Urban Development to do lead hazard reduction and healthy homes work in our 7-county district. So essentially, this grant allows us to go into homes with young children and look for lead hazards and other healthy home hazards, so like radon, pests, safety hazards, electrical things going on, and then take certified and trained contractors and use that money to go in and fix all the problems that we find. Environmental health encompasses so much of public health, and so anytime that you are eating at a restaurant, anytime you're drinking your tap water, anytime you're breathing in the air around you, that's all environmental health. And all of these systems in the United States and in the state of Nebraska, and now here at the local level, those are all environmental health systems built to protect you and protect your public health.
My name is Adam VR, and my title is Environmental Health Specialist. I also do some work as well in emergency response coordination, and with that, so emergency response coordination, it's about all the prep work that happens before the disaster and doing all things possible to mitigate it from even happening in the first place, and if it should happen, how to lessen it and increase people's preparedness and how to deal with that response. Day-to-day duties for ERC work will primarily consist of meeting with other people and just ensuring that we're building those good connections with our community, making sure that everyone involved knows what their role is during different types of disasters, and then also I would help coordinate and be involved in trainings within our department and a part of the community as a whole in order to ensure that people know what to do should something happen.
Okay, so you guys are like the people we're really glad we have but don't ever want to use.
Yeah, exactly. We're like sandbags. We're not there when you don't need us, but we come out of the woodwork when something crazy happens.
Perfect. Okay.
My job is to oversee many programs. I'm lucky and I get to lead our environmental health program, our emergency response program, our Healthy Families of America home visitation program. But I just get to help people find their way as they navigate these programs. A lot of the time it looks like me being a manager and talking to people about things, but on the best days, I get to go out into the field and talk to our community, which is my favorite thing to do. One of my big projects or my big tasks that I do frequently is a community health assessment. And that really just gives us the data to know what our community needs and how to bring our community forward and in their health. And so that it guides which grants we apply for, it can guide what tasks we do.
Typically between every 3 to 5 years, a health department is required to do a community health assessment. It usually is a survey, and it uses multiple data sources to kind of have a snapshot and to have an idea of where the population is at that point of time. We collect a lot of upstream indicators, if you may. So, indicators that are basic to you as a person. And then we collect a lot of midstream indicators, which is kind of what you're going through, what you're experiencing right now, which is largely your healthcare indicators, whether you suffer from various diseases, whether you've ever been pregnant in your life, whether you've had children, and so forth. And then we also collect downstream indicators, which is kind of where does this all end towards? Which is we try to find out what is the status of the population. And that's by using your midstream indicators, where you can say, this is how many people suffering from a chronic disease live in my community. Then you can use both your upstream and your midstream indicators by saying, the people who suffer from this particular condition, this is what they kind of look like. So you can correlate and you can tell yourself what kind of people are more likely to have this problem. And so it allows us to predict a little bit about the kind of people who might suffer from problems. And then we finally, to make the model really robust, we use downstream indicators. And so we try to say, of the people who do have a certain problem, a certain public health problem, what do we expect the final outcome to be like? And so we can actually generate to see what might happen at a community level to people who might be suffering from a particular disease or a health condition.
Okay, tell me about accreditation.
Accreditation is a lot of work. It's a ton of paperwork, but what it shows is that you're trying to do your thing the best you can. So universities are accredited, meaning that their processes are really good. Hospitals are accredited because they're doing the best they can for their patients and keeping their paperwork straight. Public health is the same thing, except it's a little bit of both. So our paperwork shows that not only do we work with our partners, but we work with our community, and we look and understand our community better than anyone else.
Hi, my name's Haley Jelinek, and I'm a health educator at Two Rivers Public Health.
And what programs do you oversee?
I oversee OD2A, which is Overdose to Action. I oversee the opioid settlement dollars for also opioids. And I do the minority health initiatives. The opioid crisis started in about 1999. What usually happens for Nebraska is when a new drug is introduced or that is harmful, it usually starts at each side of the state and it kind of slowly moves into us. So we're probably 10, 15 years behind, but we are seeing opioids sneak in. So it's our job to make sure that everybody knows what it is, it's a killer, and what to do about it. I have a community health worker, Courtney. We go out to the bars, make sure behind the bars have Narcan, and we hang posters in the bathrooms that say, hey, this is what an overdose looks like, what do you do, and then where you can get free Narcan. Minority Health Initiatives is a program that is used to gain access to services for people of for people that are marginalized, just people that need help getting services. We send information out to schools. We send it through the agency, the large agency email system. We send that all out in 4 languages, 5 actually: Spanish, Hmong, Somali, and Arabic, and also English. And that information goes all over. As a matter of fact, it's so cool that the state has picked up some of our stuff and it goes all the way across the state.
And then there's me. You see my work, you hear my voice, but who am I? My name is Akayla Leith, and I'm the Marketing and Communications Coordinator at Two Rivers. I'm responsible for any printed materials, social media posts, press releases, interviews, podcasts, YouTube, and our website. This also means that I have my hand in every program at Two Rivers Public Health Department. It's my job to make sure the public has as much knowledge about what's going on at the health department and how it affects you. I hope this brief explanation shows you a little bit about what we do. As always, stay happy and healthy. Until next time.